good evening and good afternoon to all the other candidates, participants, and yeah, today I'm going to share some of the I would say is tips or to when I succeeded my clinical exam in February recently. So well, I sat for my exam on the first day in Seremban, Malaysia, and like what have been requested by Dr. Mohammadi to share few tips for my success. Well, this is my second exam attempt, and first I would like to say that the first exam clinical I didn't make it. I lacked 2 marks, and a year later, which is this year, I sat for another exam. And there are a few things that I think I would like to give some advices to the future candidates for those who are taking the exam.
Yeah, go ahead. That'll be beneficial. Till more people join, then you can start with the feedback. Okay.
Yeah. So basically, regarding the preparations for the exam, I advise all the candidates or all the fellow participants for at least to start at least 6 months to a year. If you can start it longer, I mean, you are more ready to go for the exams. As you all know, all the registration for the exam will be open 3 months prior to the exams. So that time you start register for the exam, and then only a month later you will know regarding your exam placement results. So basically you have only 2 months prior to the exam that you finally know that you are given a seat for the exam. So I encourage you guys to start earlier, at least 6 months prior to the exam. Even though you haven't booked for the exam, go and find people to study to start your practice. This is to familiarize yourself with format and timings, and also to practice according to the exam timings, so that you can get used to the real exam situation. And of course, ideally you should have study partners. If it's not many person, then 2 to 3 study partner will do. And I encourage to practice with different people. Try to approach with different specialists or consultant, and try to get the vibes of adrenaline rush during the exam. Because once you get used to this adrenaline rush feeling, I think you get used to it during the exam. Unfortunately for me, I come from a region where there are not so many classes held prior to exam, and so I have to approach a different consultant to take me for the exam practice, and I find it works. And then and by the time probably initially you will not be practicing daily, but if you have times, at least practice 3 times per week. And most of your non-practice day, you can just do with some readings and looking at the recent past year's papers. Past year's papers are very important for me. I think the first attempt of my exam, I'm not going through all the past year's papers, and I think going through all the past year papers actually will help you a lot, and especially looking at the recent exam questions. And of course, you watch a lot of videos try to get the MRCPCH physical exam videos in YouTube. I think I can suggest you some of the good website like GK Medics, and then try to train your ears, listen to the murmur. If you have not so many patients at your center with a cardiac murmur, try to Google and YouTube for some murmur sounds, and hopefully this will help you, and it helps me also as well. And I would say you need to have a proper or experienced teacher in preparing for the exam. Yeah, so it's good you have a study partners, but it is very crucial for you to get an experienced teacher, especially those who are dealing with this MRCPCH exam, because they give you a lot of tips and techniques how to answer, and they can lead you to the correct way actually in preparing for the exam. And I'm so lucky. I think I joined also Dr. This is not, I mean, Dr. Muhammad didn't tell me anything to but this is honest from me, and I think I'm so lucky. I in the last 3 months prior to the exam, I have the times to join. I take some of the exam mock exams from Dr. Muhammadi. I take 3 mock exams. I think that times I really need somebody that can direct me to the correct path of how to see the exam itself. And and I would say I'm very thankful to Dr. Muhammadi, because she's actually helped me a lot through the exam. And but it depends on you. You can join any mock exam classes. Join as much as you can near to the exam. If you have the chance to go to the mock exam, just go to the mock exam, because it really makes you prepared for your exam.
So, I mean, you did find it beneficial, because I'm doing it online, and the thing is that some people are reluctant to do the clinicals, although you can easily do it if you have a patient. Like I made, okay. So yeah, you can. What are the course materials you recommend? Books? You said websites. Any books?
Yeah, some of the reading. Sorry, Dr. Muhammadi, count again.
Yeah, like Mark BD and stuff. What did you read? And like any specific book like that.
I divided some of the reading materials into the things that we have in the exam. Like for short cases, I think the PDF from Dr. Muhammad Abdullah Kide is good, and also Bianca Chan, also MRCPCH preparation from Malaysia, also good, and also some of the master notes by
Is that
in the Malaysia.
book, or is it another MRCPCH book, Malaysian?
It's a Malaysian books. Is the master books. So one of the good
can
notes.
You send me the name? I don't know about this one. I thought it was a simple book.
Yeah, I think I can pass it to you, Dr. Muhammadi, later.
Yeah. Okay.
Yeah. And then the other things is like secret passing to MRCPCH clinical exam, like by Dr. Chin Bing Hua, also good. But I think you need to have a very good understanding before you read this book, because it is very simplified versions. Only when you understand everything, then you just to reminds you of the tips of the. I think then only they can read these books. But otherwise, I think you need to look through all the past year's collections. I see the recent exam from different countries, and then of course practice makes you perfect. For developmental, I think Qi Bing Hua also one of the good books to read, because it's very simplified, and also there's another slide that I use that one is from one of the hospital that Malaysia's hospital that organized a mock exam, which is a good slide on development. And for history taking, I think Past Test by the Mark Betty is a good book. Also cover the short cases, communications, and of course the past year questions. Okay. For communications, I think you need to finish the communication scenario by the Rebecca Cousins, the MRCPCH communication stage scenarios book. And also, I think mock exams question as well as daily practice during your daily work. I think that makes you perfect to talk. Yeah. And another things is I think videos. Videos is actually I think find on the common videos that come out from the past years, and then you try to find the videos in the YouTube. There will be a lot of videos, and of course you need to read the pediatric guidelines. I recommend some of the pediatric guidelines 2022 to 2034, or if you are in your own country, you have your own pediatric guidelines, the local guidelines. Try to memorize the guidelines. I think there's not so much of guidelines, but you need to know what normally come out for the videos. Then you need to memorize the guidelines, the possible videos that will come out. Yeah. And I one tip for the videos, I think the less you answer, the safer you are, because sometimes we tend to give a lot of answers. However, it's just a clinical diagnosis and not so many investigation need to be done. So sometimes when you answer more, you'll be cut off a lot of marks. There's not so much of guidelines, but you need to know what normally come out for the videos. Then you need to memorize the guidelines, the possible videos that will come out. Yeah. And I one tip for the videos, I think the less you answer, the safer you are, because sometimes we tend to give a lot of answers. However, it's just a clinical diagnosis and not so many investigation need to be done. So sometimes when you answer more, you'll be cut off a lot of marks.
Yeah, you're right. If you talk too much, it has happened. One candidate last year gave me a feedback. She was not my candidate, but nice enough to give a feedback. I keep on repeating this because she's very nice. When I saw her, she even sent her, comments, the PDF thing. So she in that it was written that the exam because she was talking a lot, the examiner said she was all over the place. This is the exact comment. Okay, so too much talking can also be detrimental to your exam, because you might blurt out something wrong as well, and then the examiner sometimes it's better to talk like in the history taking, but not in the videos, especially not in the videos. So it depends on station to station. Okay, so we can start, I think, with the feedback. Any questions, guys? Somebody's asking video site. Can you name it here? Which video site? I think he's saying just to see the past exams and check on YouTube.
For
There's
the
no video
clinical,
site.
he said some YouTube videos for the clinical.
The clinical, yeah, that's mrcpch.co.uk, the famous one. Actually, that one is good, but Geeky Medics is better, actually. Although it has a adult examination, but this one has a bit of mistakes. Those people are actually trainees. They're nice enough to make all these. You can look at the PDFs, but the videos themselves have mistakes in it. So don't follow the videos. Follow the written format and the PDFs format that they've given. Okay. I'll find the link and I'll post it in the chat. Okay, let's start with the feedback. If no other questions.
Okay, so my day was on day one of exam. in Seremban, Malaysia, and I have my first station was a short case, which is clinical, and I got a station that I dislike the most, which is musculoskeletal, and of course to be in the first station, very panic, and there's a palpitation everywhere. So I got a MSK boy, a case boy. It's around of 7 years old, to be examined the lower limbs. So basically, yeah, I stumbled during the examinations, and there are few signs that are very obvious. I got this case, actually, this patient has a Bed-Wiedemann syndrome, a child with Bed-Wiedemann syndrome, and I pick up the sign a bit later, and only managed to give my my investigations and didn't make it to the management. So yeah, this is quite a very tough station for me. But then I always remember what Dr. Muhammadi told me. Always treat your every station as a new station. So the next station when I go, even though I stumble, I try to back up. I try to just put in your head that you need to pass your exam. Whatever things that happen in the past stations, just forget it and go with the flow. Yeah. So I think the one of the feedback, I think is my I think my technique of examination of the MSK is not that smooth, and of course when you're panic, you're blank. So relax is the tips, I think, but to become calm is actually calm with practice. So the next station was my second station, my other clinical station. I got the BM Duchenne muscular disease, and it's a 13 years old Chinese boy who are on wheelchair, and he's bound to the wheelchair and cushionite. This is a straight cut clear pass to me, and there's not much of there's not much of trouble, except the child is quite obese and very difficult to do the maneuver, everything for the CNS examinations. The next short case station that I got is cardiology, which is tough with post-op terminology of failure with residual PS and pulmonary incompetence. This one, I have I stumble with the differential diagnosis other than pulmonary stenosis. What else the examiner asked me? Based on the location, I said it could be a PDA because of left upper sternal edge, which is, I think this is not appropriate. You should think of more appropriate answer like pulmonary regurgitations or anything or ASD, but there's no split second heart sound. So things that I would like to say to you guys is if you want to give a differential diagnosis, try to train your thoughts process so that you can give something that is relevant to the answer. Okay. And
rigors doesn't come. I mean, diastolic murmurs don't come, but they do come. Okay,
yeah.
and complication of valve repair. I think we did this in the mock as well, right?
Yep. Yeah. And mine is a diastolic murmur, which I probably could not appreciate so much. Yeah. And for next short case session was GI. I got a thalassemia major with failure to thrive. This is a clear cut of thalassemia facies with huge hepatosplenomegaly, and the child is failure to thrive. And I have no problem with this station.
Okay, what about that MSK? I mean, Beckwith Wiedemann, what exactly was the opening statement they said?
The opening statement was, please examine the lower limbs. And at that time, the child is very clingy to the mother. And then, and when I try to ask the child to walk around and walk and run, is very clingy to the mother. So I was a bit distracted as well. I could not appreciate the hemi hypertrophy. And eventually the examiner tried to give me signal and signs that this child has some lower incision scar over the lower umbilical, which I suggest is
Okay,
from
so
the
he told you about the
palloceal.
scar.
Yeah, it's a
And I
palloceal.
think Gaia also got the same case. She also
Yep.
could not appreciate it, but she was told that the child had a neonatal, operation in the neonatal period. However, she didn't hear the part of the neonatal. So it's still, I mean, it could be anything. I mean, but we need to, if they say anything and the abdomen, you should take permission and examine. I think this is important. So it might be a hint, what is it? Okay, so any questions? Somebody is saying, please tell about dad. Dad? Duchenne? Is that Duchenne you're asking about or dad?
I
DMD.
have a question.
Yes, go ahead.
During the MSK examination, was the child properly exposed, or how much did you expose him, and how to proceed with that?
Yeah, you have to
Okay.
expose it. Go ahead. Did you expose?
Basically, the child is wearing long pants with button shirts, hospital shirts, and of course you have to expose the pants up to the, I think, above knee if possible. And then when the child was on the coach, on the bed, only then the examiner tried to help me by unbutton the shirts. So only then you can see the scars, the umbilical scar. Yeah.
So you managed to see the scar, huh?
Yeah, I managed to see the scar, and that's why I come up with the diagnosis of wet beef-Whitman syndrome. But I think it's very late, and I couldn't make it. Yeah.
Okay. So yeah, this is important. I mean, if you can see the abdomen, if they say anything, I always try to, do the relevant examination additional to the MSK. Okay, MSK is never always alone. Okay, you need to do general physical examination also with it sometimes. Okay. Any other questions? Duchenne, I think he answered. It was a case of Cushingoid with Duchenne. Any question about that, Rukia? Okay, let's proceed then.
Okay, then for the history taking, the case that I got is a 10 years old girl with underlying cerebral palsy, and with GMFCS was 2, and with recently has the recurrent tight pain for the past 2 months. And the child had underwent osteotomy and previously on gabapentin, but defaulted all the medications and also follow up, and including the physiotherapy. So my answer would be regarding whether this could be a dislocated hip or worsening spasticity. So the feedback that I got was basically I don't know if I misheard the actor. The actor was the father of the child, but I query about the speech delay as well, which the examiner said there is no such of not much of speech delay, which I'm not sure if I heard differently. And other than that, I think I score quite a very good marks for the history taking. Yeah, I think I score. I didn't get a full mark, but it's just only 1 mark to the full mark. Yeah, it's 9 or 10. Yeah.
Okay, and any questions he asked particularly?
Other questions? I think the actor or they try to address regarding the social issue, which is the OKU registrations. I mean the for the registration for the child, some of the social registration for the child, and yes, I think as a doctor, we should try to manage the concern from the father, and also put that as one of the management plan in our question and answer session with the examiner.
So the child was not registered before this case of cerebral palsy?
He was registered before, but then the cards has expired. So it need to be renewed. The license need to be renewed, and the father really concerned regarding that, because he need to go back to the hospital, and then everything will be charged without the cards renewed.
Okay, so it's like a social welfare type of thing, right? This
Yep.
Okay. Yeah, this is very important, and you should be familiar depending on your center. Also, it's not like you'll mention something for the UK. I mean, we can mention it, but ideally you should know about your local center as well, because the cases also will come related to your center.
So how to answer this thing regarding the card? So how to answer this thing that the
You have
renewal
to
and
ask
this
their
issue?
social history, right? What any problems you have, and they will say they have financial issues and or travel issues, and you have to ask deep into the financial history. How's it impacting? So this is, I think, a single father, right?
Yes, it's a single father.
So this would also be a red flag sign that social issues are there. You need to dig in when you find something positive. You need to ask more details about it. This is how to take a good history. You need to ask every single headline. This is what I tell my candidates. You can't leave any headline. You might find something in maybe the development, for example. So if there wasn't any delay in the other areas, the child may, you just touch on it and move on. But otherwise, you need to, even if it's a 10-year-old child, you still need to take a good developmental history, because it's a case of cerebral palsy. You can't think, I'll just superficially ask and get over it. So you have to take a good developmental history. And social issues are very commonly coming in history taking. So you must never leave the social history at all. Okay.
Okay. For development station, I got a 2 years old situation. Was a 2 years old boy with a right hemiplegic cerebral palsy, post meningitis, actually at 4 months old. So we need to assess the growth and fine motor milestones, and I think this one I have no problems in terms of history taking, and also doing the gross motor and fine motor assessment. It ran out quite smooth. However, I think there are one question that I cannot answer from the examiner, was if you the answer was sounds like if you could have done it differently to prevent this development delay, what could it be? So
That's the same question Gaia got as well. So
yeah.
it was basically the child up to 4 months was with the mother and did not receive any vaccines. Okay, this is the history, isn't it? So
But when
pneumococcal vaccine, but I think with you guys, the confusion is because you don't have the pneumococcal. It starts after 4 years, right? 4 months, I mean. So basically, he hinted towards that by saying if it was an outside country. So this was actually the answer: vaccination.
Yes, it's vaccination. However, as far as I remember, when I asked regarding the vaccinations, the actor said, the child was vaccinated. I mean, according to the
4 months he was vaccinated. I mean, just like 4 months right now. So after that,
okay.
follow up. But when the child was with the mother prior to the meningitis, she actually left the child in the hospital and went away. The grandmother is giving the history, right? So yeah, this is why I mean multiple feedbacks. You see the different angles. Some people get one question, some people get another. Although people might say why repeat the same day feedback, you get a different aspect of the same exam. So this is the thing. So vaccination is a way of preventing meningitis, isn't it? Other than that, of course, you should have maybe the child follow up and all those things. I mean, look at the social history. Do they have any issues? Shaken baby syndrome also comes, so you need to rule out what problems they can have. So this went well. You got full score
I got 1 mark to full
for
score.
that vaccination. Okay, yeah.
Yeah,
Otherwise, you would
because
have
of
gone
this
down.
question. Because the question is not much of related to the developmental milestones. Is just this question.
Yeah, I think we did this mocks together. So I must have done this with you. Hemiplegia, isn't it?
Yes, exactly. Yes. Yep.
No. Okay. So what's next?
And for comms, the first scenario was 12 years old girl with iron deficiency anemia, HB is very low and fainted or collapsed like somehow into the school. And then and then the results actually iron deficiency anemia. And you need to counsel for the iron therapy.
Okay,
And
a very common scenario coming on and off.
yes, so always remember for the comm station, there will be always a hidden agenda. So try to your best to make the actor tell you the hidden agenda, because like in this case, I think I miss the child actually has I think menses, heavy menses. I think
they've written the child is post-menarchal. They didn't write about the heavy menses, did they? They have written it actually that the child had menorrhagia, but in the previous feedback it was not mentioned. It just said a child was post menarche. So was it written there?
Yeah, I kind of forgot, but then but it's written in my feedbacks that the child could have heavy menses. Yeah.
So they didn't write it. Okay. So but they were expecting you to get
So
the
they are expecting us to ask a very
in previous exams they wrote it in the outside scenario. Okay.
no,
So now
they
you
didn't
guys
write.
need this as well.
They
Take an
didn't
active
write it on the scenario. But then I think they are expecting you to ask specific question like, do you start to have your menses? And how's the menses like? Is it heavy menses or there's a normal flow? I think all those. If you ask a very general questions, I think the actor will not answer you. So you must be very specific in asking the question.
Written something about it that it's kind of weird to just go and ask about this in a communication. I think they should have written about it.
It sounds like history taking. Yeah, if you ask so many questions in the comm station.
Okay, see, this is
but then
feedbacks for you guys who are giving the exam. If you get the scenario, now you better just ask about it. Okay.
Yes.
Don't
exactly.
Is it okay if I say something about this case?
Yeah.
Sure.
Is it okay if I say something about this case?
Yeah. Go ahead. I let you interrupt.
I heard...
Send in the feedback. No interruption.
I'm sorry. Just a note that this case was in the UK exam in I think this year, and the role player actually said when the candidate asked her how is she doing in general, how are you doing in school, do you have any problems, do you feel that you are missing on school, the girl then brought up the heavy menses and that she's missing a lot of days in school because she has heavy menses.
Yeah, I think because teenagers can ask questions usually. So I mean, but it was written in the scenario, wasn't it? outside? Do you know about the
Hmm.
scenario?
No, it didn't written in the scenario. I
It wasn't.
tried to.
Asking about the UK one, was it written outside as well?
Yeah.
Or is it only when you
No, it
asked?
wasn't. It wasn't. The girl said that it wasn't written and it wasn't even mentioned in the in the
It was.
anyway.
It's similar to that. Okay. Because I thought it was written outside, and the child has a vegan diet as well. But your scenario doesn't have a vegan, right? The teenager is not vegan.
No, she didn't vegan. I asked the question
Better
as
be
well.
careful. If she's vegan, don't say things which vegans can't eat. Okay, this is another thing. Vegetarian is different from vegans, and vegans are prone to B12 deficiency as well, not just iron deficiency. Okay, so they need B12 supplements and all that. But yeah, this is like a common. Actually, I've seen this scenario even in adult medicine. Comms. It's a pretty common thing. Anemia, discussing anemia. So yeah, and females always, we ask about the menses, especially in the adults. But yeah, we should do that in our case as well. So you have to do it.
Mhm.
I think it's a nice way of asking, as you said, generally, that everything okay. Otherwise, any other problems you have, like that. That'll be, I think, for teenagers, especially, or if it's some social issue you might suspect might be there. So you should ask about it. Okay, this is a good learning point. Dig out some history from the teenager. Okay.
For the next station of comms, this is a case of constipation with soiling. And basically, it was outlined how you're going to manage this case. Basically, they give the history of the child living in a separated parents, living with the mother, and then occasionally they will the boy will go to the father's house as well. And mothers complain that whenever the child went to the father's house, the boy will have these constipations. And so for this station, I try to figure out what exactly happens, whether any psychological distress that caused the chronic constipations. And mother keep asking, not sure, I don't know. So otherwise, and I just outlined all the management for the constipation. I could not find any real hidden agenda, except for I suspect probably the child has some psychological effect from the separations of the parents. And after that, I just outline all the management, and it's very important for you to get mutual consensus with the mother that agree on your management plan. And I am able to do that with the mother. And I think I'm score full mark for this station. I think it's quite doing it pretty well. Yeah.
Yeah, this is coming constipation repeatedly.
And the last two videos that I got, one is a newborn, side nose, and they put on stethoscope, and there's actually heart murmur, and it's basically you need to describe the murmurs and also the situations, and it's basically a doctor-dependent cyanotic heart disease. Possible is stopped because of PS murmur. And they really the feedback that I got from I got all the management correct, except for I forgot to tell my management is to talk to the parents regarding the disease, the prognosis as well. Yeah, I think that's actually that we do in the our daily practice work, but we didn't remember to do it in our exam. So I think, yeah, you should remember that. Anyway, I scored a full mark for this.
So I mean, it was just talked about the prognosis or any advice?
Yeah, I think just give one of the answer that we talked to explain to the parents regarding the disease, as well as the prognosis and the future plan for the child. I think they expected
Okay.
those kind of answers from you. That's what been written in my feedback.
Okay.
And the last video is this is very difficult video. Initially I thought it was a very easy video. This is 12 years old girl, very well looking, but there is multiple bruises, I think over the abdomen. Yeah. And I described the bruises or the lesions very well. That's the comment that I got. However, yeah, I think I got this one wrong diagnosis. It's a self-mutilating injury, and it's never in my mind came across any such a diagnosis. And I give after they give such an answer to you, then they ask about how do you investigate and manage this. So of course, because I never encountered with self-mutilating injury, I said could refer to psychiatry, or you can do if you need to rule out the organic causes, like why the child become having a self-mutilating injury, you could do an MRI or some brain imaging, and they put in the
Actually,
comments that
investigations were required. This is the reason Gaia lost marks, because of the investigations. No, she was saying to rule out, other possibilities, but actually, per se, for self-harm, it's clinical diagnosis, no investigations. Okay.
Yeah.
Now, and the examiner wrote, I think, no need for investigation. So basically, that's why she lost the marks. I mean, this is actually a new diagnosis coming in the video. And that's why I told you yesterday as well in the free meeting, don't jump to a diagnosis. If you see it, look according to the patient's age, think about other possibilities. If it's a well-looking child, then what possibilities could it be? And non-accidental injury, we normally used to say, now we have to say self-harm as well, if it's in accessible areas, like this abdomen and all that. So how was the shape of the bruises? Was it like symmetrical, geometrical shapes,
I think
characteristics?
it's linear light, and I give non-accidental
Yeah, that's what
injury
she said as well. Yeah, everybody would
as
think
one
that,
of them.
but we have to think about self-harm as well. Yeah,
Mm-hmm.
especially in an older child. So, any questions?